I'd like to call this meeting of the Finance Committee and Select Board to order on January 15th, 2026. We'll start with open forum. So this is, if anybody has anything,
We're in quorum now, so
You're in
I'll
quorum,
call
okay.
the Select Board in session too. Thanks.
Perfect. So if anyone has anything that they want to talk about that isn't further on the agenda? Anybody? Come on up. Just introduce yourself and
My name is Christine Dusson.
you could come and sit just so that everyone can hear you. Yeah, the microphones are all kind of in the center here.
Speak loud, please.
Hey, hi, my name is Christine Dusson. I teach fourth grade at the day school, and I am the Teachers Union President. Many of you, yes, I know many of you, so thank you for holding this meeting tonight. We are in the beginning stages of our teacher negotiations, and we've been having a lot of productive conversation with our school committee. And we prepared, I just want to read something very quickly and then just ask two questions. So we said, dear members of the Select Board and Finance Board, on behalf of the members of the Westford Education Association, we respectfully urge the committee not to vote in favor of the current proposed fiscal year 27 budget, and to instead advocate for a funding plan that more accurately reflects the real needs of Westford schools and supports the high caliber education that families who live in Westford expect. As you know, the failed override resulted in staffing reductions that continue to reverberate throughout our district. While the needs of our students have not diminished, the staffing levels required to meet them have, and as a result, educators and related service providers are being asked to do more with less. Students and staff are bearing the consequences. Rising behavioral, academic, and mental health needs of students, coupled with increased class sizes and caseloads, have pushed many classrooms and programs beyond sustainable effective limits. These pressures are occurring daily in classrooms and special education service settings across the district. Additionally, the district's plan to return more students from out-of-district placement is one we support both philosophically and ethically, as it aligns with our shared commitment to inclusive and appropriate educational opportunities. However, without significant and targeted investment in staffing and specialized programs, this initiative risks falling short of its goals and compromises student services. Westford schools cannot continue to absorb these impacts without further erosion of educational quality, staff retention, and student support. We respectfully ask the school committee to take the concerns of educators into serious consideration and to advocate with the select board and town manager for an increased allocation to the school budget that reflects the true cost of educating Westford students safely, equitably, and effectively. Thank you for your continued service to the students and families of Westford and for your thoughtful consideration for our concerns. And I know, Tom, it was probably with you like 10 years ago that you worked very closely with our association. And we looked at our competing towns, and we acknowledged that the list of towns that we are compared to changes because the Department of Elementary and Secondary Education, they look at this data annually, and so there are times where some towns don't change, but sometimes it does change. I brought copies for each of you for our competing towns, but I know sometimes committees like to see other local nearby towns. And so the paper being passed around is what DESE considers our comparable towns. They call them our market basket towns in some of our nearby towns. And it shows that although the percentage of Westford's overall budget has slightly been increasing over the past few years. Our town is still spending the least amount of any of those towns. This is my 26th year teaching in Westford. In many of the veteran staff, we have found ourselves asking, gosh, like, we just want it to go back to the good old days of, you know, sometimes you didn't know how good you had it. And so, two questions that our association finds itself asking is, the finance committee and the select board, where do you see our schools in the next 5 to 10 years? Do you see us, you know, being in the top 10 and receiving a whole list of accolades? Or do you see our schools heading in the direction of average, mediocre? In a lot of nearby towns, they're okay with that. But for staff, and one of my hobbies is watching the housing market, and I see all these homes. This town is a mixture of old farming Westford and newer Westford. And so that is why I think overrides are really hard, because some people can afford the override and some people cannot, and we respect that. We're just wondering, what type of school system should we be prepared to be in? And so some of us are here tonight. We are asking that when you're looking at the overall budget, taking into account the data that is being shared right now, perhaps some more money could be allocated to our schools and our students. So I guess my question was, and we talked at this at negotiations, and I know Sean Kelly, I saw you were on with us. We know the override didn't pass. So what's next? And Sean very eloquently said ways that the town is trying to get more money. And I know there's a lot of small initiatives going on in town. I just don't know how we're going to get the money that the system needs. And so we're here tonight to say that we're concerned. I teach 4th grade at day school. We used to, one year we were a 7-teacher team. We're now down to a 4-person team. But I can tell you that I have 26 students. 30% of my students are on an IEP, an individualized education plan. I have 2 other students with a 504, and the way I teach my students this year is very different than when I had between 18 and 22 students. It's harder to manage. I can't teach my small group instruction and have rotating groups because there's so many other students who, with the behaviors, and it's very hard. And I know that neighboring towns didn't always have.
Kristen, could I
Yeah,
just,
am I going to
a
on?
little
I
bit,
know,
yeah,
I'm sorry.
and mainly because, I mean, the school committee is on our agenda for our next meeting on the 29th, so I
Right.
don't want to take up too much
Too
time
much
away
time,
from
and I
the
know
other
it
departments.
8:45 tonight, they're giving the summary, I know.
Yeah.
So thank you for, I do tend to go on too long. But I just want to thank you for listening and taking anything of what we said into consideration. So thank you for your time.
Thank you for your input. Anyone else? Okay. So we'll move on to Health and Human Services, and first up is the Board of Health, and we have Ray Dick.
Hi, good evening. Thank you for having us. This is Megan Hughes,
Hi.
our Vice Chair. Thank you for having us.
Thanks. So if you have anything to preface your budget with, we can start there. If not, we'll just dive into questions. So,
I'm ready for your questions.
Okay.
Sure.
all right. Members, anybody? Dennis?
How are you, Rick?
Hi.
I just wanted to, first of all, begin by reviewing some of the public health reports that came out, like, for example, the diseases and things like that.
Sure.
I noticed there was apparently there seemed to be an increase in hepatitis B.
Yes,
And do you have any insight as to what's the problem behind that?
we don't. We don't know what the increase is in hepatitis B. Right here, we have an increase in both C, B. It's an inflamed liver disease, and it's generally from unprotected sex, needle sticks, things of that nature. So we do not know at this time.
Any idea what the age group would be involved?
We do not.
Okay. The other question I have for you is, you were very good to provide me with some information on the NARCON, which I applaud. And I also saw for the first time in my years on the Finance Committee, some report in the disease category about the overdose situation. It's the first time I've seen it, and I appreciate that. And I wanted to know from you as regard, I think there was 10 incidents, 1 fatal. And I know you can't, and I don't expect you to give me details about the situation. All I want to know is how solid do you think that number reflects the actual situation in the town, both numbers, the fatality and the, and I realize that there's a big lag between, Department of, between the social services, and Department of Mental Health or whatever, who provides the numbers. And I just want to get an idea what the current situation might be.
Sure, absolutely. So we certainly look at numbers for all kinds of things. I will say that communicable diseases that you brought up, we oversee 91 different communicable diseases throughout the entire year in our department. What you'll see in the report every year is diseases that we actually receive either probable or positive cases for. So you'll notice there aren't 91 categories. As far as opioid settlements, we look at things like suicide, we look at what are people dying from here in the community, how can we build programming around that. I will say with the opioid overdose, those results are from our police department here in Westford
Good.
directly. We work with both the police department, we contact fire as far as Narcan and what they're seeing in the field. And we also work with our community health wellness coordinator for the town. We have an opioid task force in which we all talk about these issues and how do we come up with a comprehensive plan. Right now we're in the middle of an opioid settlement survey for the community, and we're doing interviews with both MAP programs, which are medication assisted programs in the greater Lowell area, and we're working with recovery coaches to do interviews to see how we can help and assist Westford residents that need, whether it's from, we're seeing a lot of student gambling now, we're seeing alcohol use, not only with youth, but with adults, and so how do we make sure we're providing services? People died for this money, and so we want to make sure it's going to the people that need it.
No, that's good. I mean, I just commend you because at least there's movement forward. This is the first time I've seen any movement in that direction. And so I think a lot of it's been because of your efforts. And the other thing I was going to suggest is, and I noticed that in addition to the numbers that you get from the police, you don't have to identify the names, but you should record how much of the Narcan that you're expending. Not if you're at a fair or something like that and you're handing it out, but if you're handing it out on a regular basis to certain people requesting it, it would be a good idea to have an idea as how much of a level of demand you have. That'll give you an idea of what the real picture is. But,
so we do, every dose that we give out, we have to record, and we do have to give it to the Department of Public Health and Substance Abuse.
And you keep it yourself
Monthly,
too, right?
we have to keep record of that in order to be a Narcan distributor in the state of Massachusetts, so we need to do that.
Very good. Very good. Nice work.
And those are the kits that we give out right now to the public.
Nate?
Yeah, two questions. The first is, I see that the food inspector in your answer on that question, the breakdown, you said it was a part-time position in your answers.
Yes.
The food inspector. Is that like a 0.5 FT, exactly half time, or is it less than that?
It's
How many
actually
hours?
19.75 of the
Okay.
hours for the food inspector.
And is that, just out of curiosity, is that sufficient? Are we covering what you would ideally think in terms of doing health inspections for, that's the person who goes to the restaurants in town and other food places and stops by to do a check and make sure everything's that we're
Correct.
getting is safe?
Correct.
Is that sufficient? I mean, I don't know if that's for the number of places we have in town. Is that reasonable or is that low? Is that, you know?
For our department, it is not enough, actually. We utilize right now regional health inspector services to help cover. I think it was 2 or 3 years ago, we came to the town for an increase in hours. The position is not benefited, and it used to be a few years ago. In Westford, we have over 100 temporary food events alone during the
Temporary?
year. Temporary. Your Apple Blossom Festival, your
Uh-huh.
West Fest, whatever it may be, food truck festivals. So those are all night and weekend events. And then you have your establishments that need to be inspected several times a year.
And then my second question is, just in terms of if the state, given some of the dangerous rhetoric coming from DC around vaccinations and things like that, thankfully in our state, the governor has stepped up and said, we're staying the course. Has the state provided any resources from an educational perspective to help ensure that the residents of town have accurate access to good information on that?
So it is recently coming out that the Department of Public Health has put together a committee within New England and is working with other states to come out with their own science, which they are pushing out now to health departments' social media campaigns, which we are just starting to see, which is great. You know, for instance, influenza right now, we're seeing 3 times the numbers right now that we saw this time last year. So it's really important that people are vaccinated, and we did just build a vaccine competence page on the health department's website. We're working with our Board of Health to make sure that we're getting out all the proper science.
Awesome.
You know, because it's very conflicting for people right now, and they're not sure what to believe, so.
Unfortunately. Thank you.
I will just add, Westford is 97% vaccinated for students K through 12, so that's a really great thing for this community. Yeah.
I had a question about TB infections.
Yes.
I think, I seem to recall last year that was a number that kind of, the confirmed and likely cases were kind of jumped off the page. If I remember correctly, also from last year, the indication was that those infections were received sort of somewhere else, and then they came here and were living here, but you didn't really have any signs that it was spreading within the community. Is that still the case?
Yes, we do not have any tuberculosis positive cases here in the community. We do have latent cases, which are non-infectious, folks that have no symptoms. They carry it within their body. They don't show signs of any symptoms of being sick. So those cases are reported here, and we're required to follow all of these folks. So that's something that we do, check in weekly.
Just one last one.
Oh,
Any,
sure.
so, in addition to teens gambling, and I forget what the other one was, are there any trends that you've been noticing as we go into this next year to think about?
For
Just
thousands of things, but yes, no, I would say just with, we're seeing a lot of social media issues, certainly with all ages, right? When you're attached to your cell phone. But certainly gambling, vaping, that's a program that we follow for both Neshoba and we follow for our WA. And I would say vaccines are certainly at the top for us right now with public health, certainly.
Thank you.
Sure.
I'll say Jen. Okay. Anyone else, because I have something, but.
Go ahead, you,
Okay.
just go one quick one if you.
Okay, so Ray, I had asked about all of your grant funding
Yes.
and what it's being used for. And if I'm adding it up correctly, there's about $1 million, give or take, in the grants? Is that, am I interpreting that correctly?
Yes, you are. Yep.
Okay. And it looked like most of that is paying for things that are not tied to a specific line item in your budget.
Correct.
So they're like additional things that are being done or paid for that don't really show up on the budget? Is that correct?
Other than the
it was the-
immunization revolving account.
Yeah, so
Yes.
there was a little bit that was kind of an offset, but it looked like the bulk of it was paying for additional
Programming.
program, yeah. So my question is, what happens if we don't get those grants?
The additional programming will end.
Okay,
MRC coordinator for the town that provides all medical volunteers for things like your immunization clinics. Those are retired nurses that are volunteers that come in and provide those clinics here for residents. Nancy Burns, who is our MRC coordinator that is paid with some of this grant funding, also works closely for our emergency preparedness plans. She's our emergency preparedness shelter manager, if we should need a shelter, so things like that.
okay.
We have dental programs for seniors, older adults. We use funding now
Okay.
for things like school
Okay.
dental program.
I guess with my FinCom hat on, I'm asking, and I don't want this to sound harsh, but I'm asking, is the town gonna have to pick up that money, but it's sounding like the programs will end, correct? Like
Right, so
that
what
that-
happens?
that money won't shift to now the operating budget has to try to cover.
Correct,
Okay.
correct. So for where I sit, there are things that were in our budget in the past. I go and try to find, whether it's through donations or through grant funding, how can we maintain some of our programs and then increase them as we need them.
Mhm. Okay, all right, thanks. Yeah, let me just, yep, okay, I'm good, go ahead.
Just one quick question. Can you explain to me when you reference made to business overdose blocks? Can you explain what that is?
I'm sorry, could you say that
It was
again?
under the Narcan kits, there was a reference to a business overdose blocks. Does that ring a bell with you?
Yes, so we have a grant here in town. We also use opioid settlement funding for what's called a sandbox. It's right here in the hallway. And that's an overdose rescue box that contains Narcan. We supply those to businesses here in the community that would like one, so your hotels, Cumberland Farms, for example, your convenience stores. Close to the 495 corridor for folks that are coming off that they do administer Narcan, even employees that work there. So we provide training to them, and we provide them the $300 box for free. So for instance, Kimball Farm, we get, any business that wants one here in town can have it on site.
Thank you.
You're welcome.
All right, I think we're good, thank you so much.
Certainly. Thank you. Have a wonderful night.
Thanks. So next up is Council on Aging. I see Jennifer in the audience.
Good evening. Good evening, select board members, FinCom, and Mike, and Dan. I'll be glad to, I can open up, or I'll be glad to just start with questions.
Why don't we just dive into questions?
Fine.
Then if there's anything else, you
Yeah,
can
and I
certainly
will-
add on.
If I can, I just wanted to pass these documents around. One of the things that the board has asked me to do this past year is keep track of participation usage within the Cameron Senior Center. So I thought this might be useful to you to see all the different ways the senior center is being used and the numbers.
Great, yeah, that's helpful. Questions? Go ahead, John.
So on that front about usage, is usage increasing? I mean, I see the comments in answers to the questions that parking is a consistent issue, but are we getting more people coming to use the center, or?
I would love to have a lot of these people behind me answer that question because they are very involved in the Cameron Senior Center. So, yeah, and you'll be able to look at that with at the participation
Okay.
usage. Our usage is continuing to increase. As you all know, we're going, I think right now we're at 37.25 of older adults that make up the Westford population. Next year, that will be 38%. And, you know, we do not get funding from the town for any of our programs and services, so, you know, we rely a lot on, you know, we have our state formula grant. We also have fees for our classes. And then we have the Friends of the Cameron Senior Center. So we look a lot to our fellow departments, organizations within town to help provide programs and services to kind of be able to meet the need. And right now, this year, with us not being able to use the field with all the snow and ice, we have had to provide programs off-site. So right now, we have staff at the Road and Bush on certain days, and then we also have staff at Orchard Church. So yeah, that's a new church that we're renting facility space because we don't have adequate parking for our current programs. I am concerned about how we're going to meet the continuing growing older adult population with limited funds and without adequate space. I know I met with Mike Edwards, who was my supervisor yesterday, and you know, this is an ongoing conversation that we'll continue to have. But I appreciate that question.
Anyone else?
I have one.
Go ahead, Dennis.
Hey Jennifer, how are you?
Hey.
I remember last year there was a conversation relative to opportunities for seniors to be able to get, pick up volunteer slots to help defray their property tax expenses.
Mm-hmm.
And I know that at that point there was a sort of a deficiency, like there was only 20 slots. Has there been any movement to expand that at all?
So since COVID, we have continued to increase the slots. We haven't increased it past what it typically has been, which has been 25. This past year, or this current year, we did have two or three people that did drop out of the program because some of the placements weren't exactly what they wanted. But for the departments and the schools that are utilizing the volunteers, you know, it's been great, and I think it's you know, once you know, I think there's other people that could be involved in the program. It's just at a certain point, there's so many hours that you have to complete by March, so it's hard to fill a spot. But I think one of the challenges, you know, I'm just going to be honest, I think one of the challenges is, you know, really getting full participation from departments and schools. And I understand that, you know, some departments are really small and, you know, they have a flow and it works for them. So would it be great if we could have more participation from departments and schools? That would be good, but then of course we would be looking at probably increasing slots, and that would be additional funding that we would look for from the town. So.
That's the answer. The way it is. Thank you.
Nate?
Yeah, thank you. One of the questions that was asked in our sheet was about transportation program being funded, and the answer talked about the round trip cost of $3, but then also talked about a current year grant amount, and then that we are participating in the Fare Free pilot program that's funded, I think it's like the second year now.
Right.
And it says here that gets reimbursed for the COA for monthly rides. So is the grant that you have, is that a state grant that covers that $115K?
Yeah, that's through our local regional transit authority.
Right, okay. So that comes to,
It
you
comes
pay
to-
that, or that comes to this?
That comes to the town
Okay.
to pay for all of our drivers, maintenance.
Okay. Is that not we don't capture that in this part of the budget?
It's a grant, so it's kept separately. So we have a activity schedule that we account for all the grants and federal grants and revolving funds, but it's not part of this budget that gets approved at town.
I understand. And then the Fare Free part, that offsets the individual's costs so that
They're riding.
just like they're riding, if they grabbing an LRTA bus in town,
Yeah.
this particular one would also cover the grant. The
Right,
program
so-
would cover that.
Right, and if that grant, when that grant ends, we'll go back to our donation-based service. So right now, everybody's riding for free, which is awesome.
Well,
Yeah.
fingers crossed.
I know,
Keeps
I
going
know.
forward.
We were glad that we got funded again the second year.
Great outcome from the millionaire surtax. Thank you.
Actually, I'm going to jump on that because I had a couple more questions on the transportation. So the fare-free pilot, you said that, you know, we get reimbursed every month.
Right.
And so how does that work? Do you tell the state, you know, we had X people going these different places and it's $3 for this, and, you know, you come up with an amount, or how does that?
Right, yeah, no.
Okay.
Yeah, good. Actually, every month, our transportation dispatcher it's mandatory that they complete a required report to the
Okay.
LRTA. So we're basically, we provide that report to the town manager's office, so it's always on file. You can see the ridership, you can see when we have a loaner van, you can see the gas usage, you can see maintenance costs, you can see the breakdown of people that are using the service. So it's just basically the stats from the month.
And so we receive funds based on those, based on that
Off
report?
that report.
And is that in addition to the LRTA grant of 115,000?
That's correct.
Okay,
115.
15?
Yeah,
Okay.
yeah.
Okay. All right. And where does that money go? That was my last question.
It goes into the town,
To the general fund, or
Which one, the grant?
Yeah,
The-
the donation based.
the fare-free pilot?
It's kept in a separate account. So, yeah, so most things are kept separate when it's not part of the general fund budget, so.
Gotcha.
So typically, if we use up our LRTA, that's when we'll try to tap into that.
Okay.
Is that correct, Dan?
That's correct, yes.
Okay. Thanks.
Thank you.
Anyone else? I think we're good.
All right, thank you.
Thanks, Jennifer. Okay, next up, veterans. And we have Colin is new, so he's going to give us a little brief intro.
New kid on the block.
Yeah.
I've prepared some, just a brief statement to introduce myself. Good evening, members of the Select Board and Finance Committee. For those who may not know me, my name is Colin Bodie. I'm a United States Army Iraq veteran of Operation Inherent Resolve, and it's an honor to serve as the Veteran Services Officer for the town of Westford. Thank you for the opportunity to provide a brief update on our work so far and for the year ahead. My work as a Veteran Services Officer is guided by three core priorities: ensuring access to benefits, meaningful outreach, and strong collaboration across all departments, and working with our community partners. Veterans' needs are often complex, and effective support requires coordination rather than siloed services. Interdepartmental collaboration has been a major focus this past year. A strong example I have is our partnership with the Westford Health Department to provide fall prevention kits to veterans in need, improving safety and independence for older veterans and those with disabilities. I've also worked closely with our senior social worker, Allison Christopher, to connect veterans and their spouses with senior services, housing support, and caregiving resources, ensuring continuity of care without duplication. Outreach remains critical. Through ongoing social media engagement, 2 WestfordCAT interviews, and expanded after-hours appointments at the Cameron Senior Center, we've significantly reduced access barriers. As a result, our outreach has grown by over 200%, with one post online reaching more than 7,000 community interactions on our Facebook. Demand for benefits remains strong. We currently have 30 active claims, with 5 new compensation and pension claims filed with the VA in January by itself, and it's only the 15th. This places Westford ahead of several neighboring communities and reflects both effective outreach and growing trust in the Veterans Services Office. Looking ahead, we have several initiatives underway, including Chapter 115 renewals, a March Coffee Social at the Cameron, 3 holiday events, EOVS conferences, expanded collaboration with the Roden Bush and Good Pick and Farm, and a 3-day on-site academy program for returning veterans at no cost to the town. We also secured donated Christmas and Thanksgiving meals for 18 Westford residents during each holiday. New initiatives this year include a quarterly veterans lunch funded fully by donations, a Memorial Day grave cleaning volunteer effort with the school system, periodic meetings with low-income veterans regarding cost of living adjustments and changes regarding veterans' disability and Social Security, quarterly veteran biography features, and living veteran history programs. In closing, this work is only possible through collaboration and the continued support of this board and the Finance Committee. Serving Westford veterans is both a responsibility and an honor, and I remain committed to advocating for those who have served our town and our nation. Thank you for your time and your continuing support. I'm now open for questions.
Thank you. Good, Dennis.
Colin, how are you? I just have a question for you with regard to, as I understand it, the Veterans Administrative Hospital right in Bedford sort of serves as the gateway for any veteran that wants to register with them
Yes.
early on. And I was just wondering, do you have a program that allows veterans who may not be aware of that they can go down there and actually get themselves plugged in early?
Yeah, so we've maintained a couple of different initiatives to try and inform veterans of the health care benefits that they're eligible for. That's kind of the main reason we've been really bumping up the outreach in town, because a lot of veterans don't know about the medical benefits. I'm also able to directly apply them for those benefits.
Oh, you can?
Yes, sir, filing what's called a 1010 Easy, which is the document that basically initiates the care at the Bedford VA. They also can apply for several C-Box VA clinics, which are around the state. The nearest one's in Lowell. It's actually the one I use.
Yeah, but what I'm talking about is, they may not have any immediate needs, but they can actually get into the system so that, like, later on in life, when they start to have health problems, they can check in. And is that covered as well?
Yes.
Okay.
Anybody else?
Thank you, Colin. I want to hear just a little bit about the Living History Program with this Western Schools. Can you just tell me what that is?
Yeah, so I've been very interested in trying to educate our youth more about veterans and that we have some real heroes in this town. And so recently I reached out to the superintendent, Dr. Chu, about maybe having some veterans or even myself go into town, go into the schools, and explain, their past, their history. And they've signaled an interest in that. They had a program for it previously, but not much has kind of been going on with it the last few years. So we're currently working with the history department to arrange for maybe some veterans to come in and give kind of like a speech about their service to the country and the conflict areas that they served in and all that. So that's some of the initiative. I'm also looking to be working with the Historic Society as well.
Oh, that's great. Thank you.
Absolutely.
I'm just a statement. I remember going to school a long time ago, and they had my high school in South Dakota had a similar program and brought vets in, and I still remember many of those encounters. They definitely left an impression on me.
Thank you.
Yeah, that sounds great. I'm just curious, do you know how many veterans we have in town?
That's a great question. We've been working to try and establish a firm number. So the census has it just shy of 700. It's definitely way more than that. As I've come in to this position, I've run into dozens of veterans that aren't on the census, whether they be new veterans that have moved into town or veterans that just didn't put that they were a veteran in the census. We're putting the number closer to 1,000 probably now, which for a population of 26,000 is a lot. Also, it's important to remember too that we maintain and assist the spouses of deceased veterans who never remarried. So, and the children of those veterans as well are also eligible for a lot of federal benefits. So that's also a larger population that we work with.
Okay, great, thank you. Any other questions? Thank you.
Welcome and thank you.
Yeah.
Yes.
Thank you for your time.
Welcome to the team.
Thanks.
Okay, Next up, we have public safety communications. And we have somebody online.
Andy Sherman.
Okay. Hi, Andy.
How's
Okay,
everybody doing tonight?
good, how are you?
Good, thanks.
If you have an opening, anything you want to tell us, feel free. If not, we will dive into questions.
All right, I'm ready for the questions.
All right. Anybody have questions on,
Before me.
anybody? All right, you're up, Dennis.
I am, I guess, all right. All right, Andy, how are you?
Doing well, thanks. How about you, sir?
Good, thank you. So, I authored some questions to you, and there was one question, and most of I think were explained about it. There was one question I was a little troubled by, and it had to do with the regionalization effort. And I think you responded that you had multiple conversations with municipalities, facilities, logistical matters determined not to be the best interest of the town at this time. I think that was your response to me.
That was Kristen's response to that.
That was Kristen's response.
Sorry.
Oh,
Didn't mean to
okay.
interrupt.
I guess that was the one I thought it was from you. I didn't expect you to go out and do that. I mean, that is actually Kristen's responsibility. But here's my concern. We're already starting to get information about budget pressure coming in 2027. We know that. We had a very tough year last time around with the override. We've been hearing about the override loss. We're also picking up information about issues with finances and people having financial trouble in this town. Before anybody decides to start talking about increasing taxation, there has to be some meaningful effort to try to take some issue to try to reduce costs. Now, we've heard a structural deficit. We've heard costs are going up, revenue is decreasing, which are all structural. I get it. But one of the things we have to really start thinking about is redesigning some things. Because if the policy is going to be just passing on tax overrides, this is going to be a very difficult place to live, all right? So one of the things that we were sort of suggesting and have said in the past meetings was, we begin to start seriously looking at the idea of regionalizing certain services, and public safety communications would be one of the most obvious, okay? We might be able to start bringing down the costs that we're now footing out of our budget, sharing that across the board. So I just wanted to put that on the record so that you heard it, okay?
And Dennis, maybe when Kristen is back,
We need to have a conversation
she can
about
address
this,
that.
yeah.
Absolutely.
Any other questions? No? Thank you so much, Andy.
Thank you very much. Thank you for your time.
Thanks.
Thanks, Andy.
Okay, next up is the fire department. Chief?
Can I get the same response as him?
We'll see.
Good evening, Lieutenant Fire Chief,
Your budget's-
Deputy Svatek,
Okay.
and Nick Demmons. Thank you for having us this evening, and ready for
All right.
questions.
Questions? Who's up first? Dennis?
Chief,
Anybody else
Good,
first?
how are you?
Go ahead. Tom? Did you, or?
I do have something. Yeah.
Go ahead.
Dennis, do you want to go first?
Go ahead, go ahead.
We'll let you go first.
Just to check in, Chief, with, we've not been able to staff at the level that we would like to staff to meet the needs of the town. I just want to check in on how your team's doing, what morale's like, and kind of what's the day-to-day like trying to manage with the resource level we've got.
The resources we have are obviously not enough. Our call volume is increasing. What's more concerning to us as fire chief and deputy chief is the complexity of the calls becoming more, requiring more resources, and the result is injuries and stuff like that. We're seeing quite a few injuries of late, so obviously staffing is a critical component right now. We definitely need more. The morale, I mean, it goes up and down. You know, they're not gonna show their true colors when the chief and deputy are walking around, but you can get a sense of the room, you know?
So your police colleagues educated me a while ago about the rising complexity of calls and what that meant. What does that mean in your context? How are they getting more complex?
The deputy can touch base on that.
Sure. I can definitely add a little light to that question. So With the transition to the paramedic program many years ago, we have an ongoing quest to provide better service, and better service, and better service. And it's kind of an addiction for us to be the best paramedic department in the area. And with that, we take on new roles and responsibilities, as well as provide care that we've never done before. Our EMS coordinators have gone to great pains to roll out a new thing, which I believe is starting either this week or next week.
I just signed it, so it should be coming up.
Good, which is the ability to administer pre-hospital antibiotics. And now it's a special study, has a great deal of paperwork involved in terms of the subset of people that it'll apply to, but the help that it can give is just huge in terms of preventing a long hospital stay with sepsis, or worse, not coming out of a hospital because of a sepsis case. And this is just a small little window into our efforts to provide care. Now, the problem is it takes longer to do all that stuff. And so our call volume's increasing, our on-scene time, or scene turnaround time, if you will, also has an increase because of the amount of things that we do on a call now, as opposed to you used to just throw them in the back of the Cadillac and drive them to the hospital as fast as you can. It's not like that anymore. We really provide top-notch pre-hospital care, and unfortunately that takes time and resources to do. The other problem that we run into is even if you guys could fix this tonight, say go hire 4 more people or 5 more people or 8 more people or whatever it is, onboarding takes a lot of time. And to get a new person up to the level that we expect them to perform at can take up to 2 years, depending on their previous education and the history that they have. So it's not an overnight fix. The buildings that are going up in town are going to go up a lot quicker than you would be able to react and change our staffing. So we try to think long-term with our wants and needs, and it's not an immediate thing. It has to be really thought out. It's unfortunate that all of this happens when the budget's so tight, and I understand that you can't just snap your fingers and, hey, the education gets some, the police get some, the fire gets some, because it's just not there, right? So tightening belt, eventually you run out of holes. You get a left punch out, you make a couple more, but even then, sooner or later, you have to be able to add. And I don't know when you get to that point. I don't know when it becomes critical. It's really up to you guys as the finance committee and the town to make that decision. We'll try as hard as we can to make things work, but it's definitely one of our concerns, staffing.
Some of the other complexity issues is obviously with the Neshoba closing. The hospital wait times have increased. I mean, we could have a typical ambulance transport somebody to Lowell General or Emerson and have a turnaround time from the time they get the call to the time they're back in service of an hour and 20 minutes. We're finding now that it's extended upwards of 20 to 25 minutes longer, because you have those patients that were going to Neshoba going to these other area hospitals. So the hospitals are congested. As the population grows, population ages. As population ages, the complexity of the calls get, on the ambulance side, get more involved. But that's not, on the fire side, we have the same things. I mean, last month we had or a month and a half ago, we had the propane tank truck get hit on Boston Road. That wiped out the whole shift for 3.5 hours because of that call. I mean, that involved hazmat, that involved state police shutting down the highway. We're finding more and more of those. You know, these houses are getting solar panels and electrical storage systems. Those are real concerns. If something happens, a runaway of those things, the battery fire at the school last fall, these things take a whole shift out of service. And then we do not have the resources. We have to call mutual aid, which then that extends their ability to answer their calls. So it's not just the medical side, it's the fire side, and the response times have increased as well because of these back-to-back calls. I mean, last fiscal year, our back-to-back calls were 28.2% of the time that somebody else was our units are already tied up.
Good, thank you. That's really helpful for us to understand what's going on.
Dennis?
Chief, when you just referenced the new program that you've taken on, right? What was the name of the program?
It's the antibiotics.
Antibiotics, okay. So, let me ask you a question. In your mission statement, I mean, who gave the authorization to you? Is it on your own volition to go in and basically open up a new program, or what was the impetus for that?
The EMS coordinators, it's other municipalities are doing it, other regional, like Lowell General Hospitals doing it. It's a no cost to us. It's just another service that the doctor, our medical control doctor, felt comfortable allowing us to trial period. So it was recommended by him and the EMS, the 3 individuals working as part of the EMS coordinators.
So the program's not going to put any more burden on your resources?
No, it's just a training and some antibiotics, and it's a trial period. So right now, I believe it's going to be a 6-month trial period.
And the value of the program far outweighs
Yeah.
any strain that it might put on it.
It's a great, it's in line with like you're suffering a stroke and you get the TXA. It's getting you recovered quicker, and that's the ability our medics have to the taxpayers of Westford. They're able to give these medications. They're able to do this stuff before they get to the hospital, which starts the process of healing faster. So it's a great resource.
And I sent some questions to you regarding the overtime, which is, I think it was 495,000 you reported this year. And I tried to see if I could understand the relationship between that and the ambulance. Now, I understand the ambulance operates on the enterprise thing and it takes care of itself. But correct me if I'm wrong, the impact on the ambulance does affect the overtime on the fire department. Because when you have to disassociate a firefighter and assign him from as a third member of the ambulance, that opens up the overtime slot for the fire department. Isn't that how it works?
No, the fire department overtime is separate from the ambulance overtime. The overtime is based on the operational size of the shifts. So in other words, the overtime is only created when someone takes accrual time off or sick vacation or gets injured. That's when overtime.
So when you have to backfill for somebody that goes on the ambulance, who pays for that?
They're on duty. They're already being paid.
You don't have any,
We don't call somebody backfill, nope.
All right, good.
Nope, they use the resources that we have during the daily staffing to go as a third member on an ambulance.
Thanks for clearing that up. Appreciate it.
Go ahead, Nate.
Sorry,
technical.
Chief, one of the things that just kind of jumped out at me here was your educational incentive budget going down.
That's due to, we've had quite a bit of retirements.
Okay.
So as the senior firefighters retire, their education of the new people is a lesser amount.
And it's probably a percent, is it a percentage or is it a fixed?
It's
salary?
based a percentage in the contractual.
So therefore, if someone's got lower on the pay scale, then they're even, they have the same education.
Correct, it's lower.
Have a
Yeah,
lower
it's all
percentage.
based on the collective bargaining agreement.
Okay, great. And then the other thing I noticed was on the overtime budget, I was confused as to why it has the FY27 request at 750, but the FY27 TMR at 495. I don't know if that's you or it's
Yeah, that was our request due to the 5-year calculation of what we've been spending on average,
Which one was your request?
the 750.
Okay.
But
And then it shows up what's in the TMR
That's
column.
the
That's
town
the town.
manager,
I see.
yeah,
Okay.
that's her recommendation.
Okay.
Yeah, go ahead, Dennis.
So on the report, on the question regarding mutual aid, correct me if I got these numbers right, but you responded, our town responded 219 times last year on mutual aid, and we requested mutual aid 141 times. Can you explain the reasons, what that entails, and why the number of our requests was a little bit higher than our sending than it was, our receipt was?
the mutual aid that we've provided is Mutual aid is reciprocal. It was adopted by the town through the state many years ago. So the mutual aid, what you're seeing here is how many times we're going out, is we're providing whether an engine or an ambulance to another community.
So what was the, what 141 was?
That's what,
Received.
that's how many
What was
times
the
we
cause
asked.
What was the cause for that, you know?
Because we didn't have availability of apparatus, the same reason why they asked for it. So if you look at the 219, we request 141 times, that's just us. 219 is all the surrounding towns. So we're not going to one community 219 times. So like if Chelmsford has a fire, we go to the fire. Lowell has a fire, we go to the fire. Littleton needs an ambulance, we go for an ambulance. It's all the towns in District 6 we do respond to. And those mutual aid out also account for, because we're also part of the district task force, so we could go to a brush fire somewhere, anywhere in the state. We could go for, like, the Brockton Hospital fire. We had a potential, if they called our district, we would have went to that.
Okay.
So it's not just local.
Can you give us a little profile on what the 141 sending in to us was about?
The majority of those would be ambulances.
Ambulance.
We're requesting ambulances in.
Thank you.
So to put it, on general average, we request Littleton comes to us with an ambulance, on average 40 times a year. Littleton. Tingsboro was like 16. Trinity we call, Carlisle was called a couple times, Acton, Groton, so.
So how did,
Go ahead.
how does that work from a billing perspective? And same thing if we send our ambulances to another town?
If we send our ambulance out and we're transporting, we're billing for that transport.
Okay.
We bill the patient's insurance company.
So if we call mutual aid and Littleton comes to Neshoba Valley Ski Area for an injured skier, they have to take him to the hospital, they're doing the billing?
They're billing, correct. Yep.
And just to kind of continue that a little bit, does that ever, do any of those mutual aid calls when we're going out to a different community, I don't know how to say this, is Westford ever subsidizing that with taxpayer money?
We bill their insurance, and if they don't have insurance, we send them to collections. So we're trying,
Okay.
our ambulance company, our billing company diligently tries to recover the money, but there's only so much chasing you can do.
Sure.
Some of these people give false addresses, and that could be anywhere. But
Right.
our collection rate on the ambulance is 89.2%,
Yeah, I thought it was
which is
89%.
phenomenal. I mean, we do a good job. I mean, me and Nick and the deputy, we do a
Yeah.
great job getting all this information together for coastal. So.
Yep, and for the most part, it seems like,
The other
there's
thing
not a
about,
lot, I mean, there is a general fund subsidy to the ambulance, but I think a lot of that kind of goes out buying our equipment, and so,
one of the things,
seems to
one of the
equal
things
out.
you gotta remember about the ambulance is, we can bill as much as we want, but there is limits, like the government sets limits, like we're only gonna get so much from Medicare, we're only gonna get so much from Medicaid. Town of Westford has a contract with Blue Cross, so we have agreed upon rates. So anything above those rates, we have to write off.
Another question on that was, according to coastal medical billing, in the answers to your questions, it looked like the Medicaid rates for 25 and 26 were the exact same, so was there no increase?
There was a slight increase. Did I give you the
Yeah, it's
the
in
latest
there.
one? It was like $9 or $13. It wasn't a
Okay.
lot.
All right, I'll check on that
If
again.
not, you can just let me know.
Yeah,
I thought every single number looked the exact same from 25 to 26.
They sent me one, and then a whole bunch of us emailed and said that the rates didn't change. They sent another one.
Okay, maybe I
So-
saw the other one. Okay, all
I'll try to look tomorrow.
right, thank you so much.
Yeah, it's in the packet. It didn't go up much, like $8 or $9
Okay.
per
Yeah.
But that's, again,
It's-
that's just what it is, right?
Yeah.
We don't have
And
any,
the ambulance rates do go up yearly. because the
Automatically,
select board
right.
approved that back in '23,
yep,
so.
okay, go ahead.
Thanks, Chief. Could you give us a quick update on some of your heavier capital equipment? I think the last update that I recall, we were sort of going down this trajectory where the lead times were very long, and then the expected life of our existing equipment wasn't kind of matching up with that. So where are you sitting now?
Deputy monitors the equipment stuff, so I'll let him answer that.
I can help you with that. We, with the help of the town managers and all of you guys, we managed to secure a truck that is a stock truck, and it's currently being outfitted for us. Lettering is done currently. I think it's in the lettering shop. I think we approved the lettering of it today. And various trays and shelving and all those other kinds of stuff need to be built for our equipment. That will take about 3 to 4 weeks, plus or minus, depending on how busy the factory is. The shelves actually get made at the factory and then sent out to get installed. And then finishing touches like, I believe, what day is it today? Thursday. So Tuesday, the radios would have gotten approved at the Select Board meeting. And they'll be ordered. The headsets for the truck shipped on Friday of last week, so they'll be here soon. We're fingers crossed looking at about 2 to 3 months before that truck's actually in service, because once it shows up here, there'll be shift training for it and various other things. If it arrives after salt season, I won't be upset, because it's one more winter that we won't have to worry about it rotting away. But that's it for the engine. We received an update on our ladder, which is already a few months late, that it's not being built yet. So we're still holding our breath for that one.
Once it starts being built, they say it takes 4 months, so.
Is this the one that's like 4 years or something?
It was
or?
3 years. We're hopeful to get it this summer. That's what
We're hoping June-ish.
So.
Yeah, on that engine, I suppose that probably knocked off about 3 years off the lead time that you were looking at before.
We were able to knock off, yeah, it ended up being, you're right, around 3 years. It's not going to be perfect for us, but it sure is going to help us out. And,
is it new?
And make the town safer. Yes, it's brand new.
Oh, wow.
Yeah.
Well, that's a score.
Yeah.
Any other questions? And we're kind of going back and forth between fire and ambulance, which I think is fine. So if anybody has fire or ambulance questions.
I just have one question. Thank you, Chief, for everything that you guys do. I mean, it's a lot of work on the fire side and the ambulance side. I didn't want to open a can of worms with my questions about the mutual aid, but I thought there were interesting questions to ask, at least to get the information out. But slightly different. So Rogers Fire Station, how often is that closed? And is it a staffing issue or is it an equipment issue that causes it to be closed?
Which one? The Rogers Station?
Yeah.
It was closed 3 times last fiscal. It's more of a staffing, so when we don't have money, the funds, or someone goes home sick, we can't fill that shift. If nobody volunteers to come in for the shift, we're not able to fill it.
Okay.
So we move that sole firefighter up to headquarters. So
So you only staff it really with one?
we staff it with 2.
Two.
2 people. So if someone goes home, that engine will be out of service. But there was 3 times that we closed the station due to staffing last year. 3 full shifts.
And do you bring the vehicle back to the main station?
We leave it down
You
there.
leave it down there?
Yep,
Okay.
How long is the shift?
24 hours. The overtimes are split up 10 days and nights, but the shift is 24 hours.
So you said 3 times in fiscal '25?
From March to July 1.
Oh,
Yeah.
okay.
That was full shifts. There were other miscellaneous shifts where people went home that we couldn't fill short shifts, so we had to wait for someone to come in for a night shift. There was several of those.
And if you know, how often do you respond to calls out of the Rogers Fire Station?
That station, so last fiscal year, that station responded to 702 calls.
Wow, okay. And how many times, do you know how many times it couldn't respond because it was closed?
I do not have that information.
Just So it's a fairly important station.
All 3 stations are important. I mean, I can't emphasize enough that the the men and women of the fire department do a phenomenal job. They
Absolutely.
make us look good. They give the taxpayers the best care we can possibly give, but there is a cost to it.
Understood, absolutely.
Just to further detail, so the response time impact, if you're not able to respond to a call that would normally go out of Rogers and you have to respond out of the main station, what's that?
It's between like 6 and 10 minutes. There's many variables depending what part of the district
That's
it's
a lot.
in.
A lot of bad things can happen in 6 to 10 minutes.
I mean, to put it in perspective, a fire doubles in size every minute, so.
Thanks.
And if you think about the medical side of it, a cardiac arrest, you know, CPR is critical to survival. So the longer the person's without CPR or life-saving measures by our paramedics, the chances of survival reduce quite a bit.
Chief, if possible, either going forward or if you can look back and figure out, how many calls should have gone out of Rogers, but it was closed? I'd be curious, again, whether you do that going forward or if you can look back.
Yep. Tom, to build on the staffing and stuff like that, another critical component that we keep getting violations from the state when they come out to inspect us is an EMS coordinator's position. Right now, the role is shared between me, Nick, and 3 firefighter paramedics come in on overtime to do that one position. There's a lot of stuff being missed, a lot of stuff.
The preferred way is to have someone dedicated in the role.
The right way to do it when we started this ALS program back many years ago should have been to put on an EMS coordinator to establish how the system was going to work. That wasn't the case. So we've been playing catch up for that. So that position would be responsible, well, right now, we're responsible in the 3 paramedics to organize training, develop training, do all the licensing, do all the narcotics, state requirements. I do the billing on my end. So every week I'm getting face sheets and I'm doing billing and cross-referencing to send the stuff to Coastal. So there's a lot to that position. And graciously, the 3 that are sharing the role with us, it's great that they're doing it, but it seems to be a position that the individuals stay on for a couple of years, then they give it up, and then we put it out to the department again to see if somebody else wants to do it for a little while.
A lot of burnout in
It's
there.
a lot of burnout. A lot of burnout, because they're doing stuff while they're supposed to be working on duty. They come in and do stuff on their off time. Obviously, they get paid overtime, but it's a critical position.
And although they do an excellent job, everyone who has in that position has done an excellent job for us. The continuity of what they try to do is really broken up when you have 3 people, 4 or 5 essentially doing one job. So it's very difficult.
And we understand the fiscal constraints, it's something we need to look at.
Yeah, well, thanks for sharing that. I mean, we need to be aware of where service shortfalls that are affecting residents are happening. So I know oftentimes, I think everyone who works for the town puts on a good face and
Yeah,
wants to show they can handle it and that they're going to do their best with what they've got. But I think sometimes that means we don't hear the whole story and can't fully appreciate the challenges and the trade-offs. So I appreciate
I mean,
it.
the service that we provide is phenomenal. I mean, I enjoy getting good letters and stuff like that,
And is the EMS coordinator, is that a full, like a 40-hour week, whatever?
The idea would
full-time is,
be a
or what is it?
40-hour work week, and it would be Monday to Friday, but it would also be another resource to respond to calls during the day. So, and another paramedic.
Okay.
So it could be utilized, like fire prevention's a Monday to Friday position. Him and I are Monday to Friday positions. We respond to calls quite regularly.
So it's
So
not
it's
it's not a full FTE trade-off. It's because the person can do some of the work that.
It can do some of the work, yes. So it'd be an additional response during the day when they're here, you know what I mean?
Dennis?
So Chief, you gave me an explanation, I asked you for an explanation on ALS versus BLS, and you provide the explanation that ALS offers, can administer medicine, perform invasive treatment, things like that. So I obviously, it's a higher scale of service. Can you explain what BLS does?
You
want to talk about?
Sure. So there are a certain amount of medications BLS providers can give. A level of a call is really only determined after an assessment's done. So there is a lot of information gleaned from an EMD dispatch, but the truth is really in the pudding when you get there. So our ambulances are staffed at the paramedic level, and the call pathway is determined after their assessment and what level they need to provide, and therefore translates into what level they will be billing at. Not us, obviously, we don't do the billing, but our billing companies. So it all starts with the highest potential possible and kind of comes down or de-escalates from there as the call develops.
And what breakdown would you, if you could give a ballpark, what's the breakdown between ALS, of the total calls, ALS versus BLS? What's the percentage breakdown?
It fluctuates. There's a lot of variables to that because we can't determine, like.
What's your operating experience?
What the call. Last year was like 46 ALS and then 54, somewhere around there. It was pretty even.
Let me ask you this question, just for the sake of trying to develop the financial idea about this. Could the BLS service ever be contracted out to a private vendor?
No.
And why not?
Even the BLS providers we have in the department, their service that they provide, just because they don't provide the ALS level service, they still provide a great service. They're still firemen. And we can't the department can't operate with just BLS and ALS. We still need the firemen. You know what I mean? It's, they're still as valuable as the ALS providers.
And the level of the care that they get when they go through our system is just, I think it's what the townspeople deserve, and I wouldn't feel comfortable having that be farmed out.
Another thing to remember is our BLS providers train with our ALS providers all the time. They understand where the stuff is in the ambulance. They understand the paramedic needs something, they know where to get it. I mean, you can't replace that. When you bring in a privatized ambulance, they don't have the same care and dedication as our people have.
Go ahead.
Just follow up. I would, on Dennis's question, I would also imagine, maybe, do you know of any communities nearby that have privatized ambulance service just for BLS? Because to me, from a monetary perspective, I would think you either privatize the ambulance because the ambulance company knows they're going to make their money on the ALS claims, and just giving them the cheap claims is not going to cover their base operations.
Correct, and I mean, the town of Chelmsford has a private ambulance company. We go to Chelmsford sometimes because the private ambulance company can't get there. So that's a risk that first call may not be provided an ambulance, so they call us. So right now, when you call an ambulance, we have 2 staffed ambulances. The only time that we're not able to provide an ambulance is if we're all tied up. And then we call an out-of-town ambulance, but we still have an engine most times available to go to that call to provide a BLS care.
Anybody else? Fire or ambulance, because I'll let these guys go. Knock out both of them. Okay. Nope. Did I see somebody? No. Oh, you're good. Okay.
Thank you.
All right. Thank you so much.
Thank you.
Thanks, guys.
What's up next, Dan?
Sealer weights.
Sealer weights.
Management, like they're small budgets, so.
Yeah. Yeah, there's not a lot.
Yeah.
We know who the director is, so we're all set.
Yeah.
Okay, so sealer of weights and measures. Anybody?
We still do that?
It's required,
It's,
yes.
yeah.
gas pumps.
I can give just a 1-minute summary. So we are now contracting that service out through the town of Chelmsford. Previously, we were contracting it out through NIMCOG.
Right, okay.
I will say it's markedly improved in terms of the number of inspections and the accuracy of those, as well as the revenue that we're receiving from it. So we're building out that program in
Okay.
partnership with Chelmsford, and it's working
Great.
out very well.
Okay, that's interesting. I didn't realize that. Emergency management? Anybody? Okay, nothing there. Animal control.
I can answer questions on animal control. We're also joined by our 2 ACOs, Kirsten Hirschler and Stacy Bruce. I'll just give just a very quick summary, and I think really I would point you to the budget narrative. There is an increase in animal control this year, a little over 10%. The primary driver of that is really call volume. In the last 5 years, FY21 to FY25, we've had almost a little over 100% increase in calls. Budget has decreased 10% in that time, so we are woefully under-resourced for animal control. Our two officers do an amazing job keeping track of what we have. The increase that we have is actually due to the need to have one overlapping shift so that we can have some training and they can handle a little bit more complex calls. But beyond that, happy to answer any questions, and they're available to answer anything that I can't.
Anybody? Go ahead, Nate.
I was just going to point out that I think it's interesting that the deer hit by car is already halfway through the year exceeding last year's amount.
Well, it is.
Maybe we need to increase hunting season advertising.
It's the consequence of development. We've had additional development. It's pushing animals out. I mean, obviously, this is the big time of the year for deer. You're, tail into the rut, so they're out. But I think generally speaking, their calls have increased really in every single category, and this year is tracking to be higher than last year. And just like the calls that we get in the other departments, in the other public safety departments, they're handling a lot of those same calls. Any call that involves an animal, typically animal control is going to have some involvement in that.
I'd like an explanation. It was a very interesting comment that was provided when I asked about the increased service demand. And the comment was that mental health issues and financial insecurity are increasing. I'd like to hear what their assessment is as to how that is affecting the service demand.
Sure. I can ask Kirsten to jump on and unmute, but basically, as Department of Health mentioned and as even the Veterans Office mentioned, we have a lot more collaboration happening now in recent years between our different departments that interact around mental health issues, financial insecurity. A lot of those issues do involve animals. We've actually had cases where veterans, animal control, Board of Health, and Public Safety have all interacted because they're very interconnected. But either Stacy or Kirsten, do you want to give a little bit more information on that one? Because I think you've got some more firsthand experience in how those work.
Sure. So the question is why the increase in mental health? Is that the question?
No, just explain the comment. The comment came back, mental health issues and financial insecurity is increasing. That was the response in the questions. I'd just like to have a further explanation of that, a little elaboration on it to get a better picture of what that means.
Sure. Well, so we've had a lot of calls, especially post-COVID, a lot of financial insecurity. People can't find housing where you can include pets, so they're dumping their pets, they're trying to surrender them, they can't afford vet care. So between calls from residents, calls from veterinarians concerned about the welfare of pets, that's one aspect. And like Mike said, we are often involved in other calls that involve the police initially or the fire department. Even veteran services, we've interacted with them as well. A lot of really complex calls that involve a lot of people, and usually there's some mental health issues involved.
How about issues with diseased animals like rabies and things like that? What's the incidence with that?
So when we're handling rabies vector species, we assume that all animals have rabies for our safety and for the safety of the public. A lot of these animals, most of them do not have rabies, but unfortunately the symptoms that present for these animals are all pretty similar with what rabies presents as. So head trauma and distemper and rabies all present similarly. So yeah, we have a lot of those. I think last year we had 3 to 4 positive animals, which was an increase from other years, but animals that have had contact with somebody's pet or a person, we send them in for testing into Jamaica Plain.
I have to ask, how's the bear population going?
Actually, this year there weren't as many calls or sightings of bears, surprisingly, compared to other years. Seems like there's a lot of bobcats. I feel like this coming season's going to be the season of bobcats.
Thank you.
But yeah.
Yeah, thank you. Anybody else for animal
I wouldn't
control?
want to meet any.
Thank you so much.
Thank you.
Thanks.
Yeah.
Okay, so I think that wraps up all of our departments for tonight. We're gonna go in and, do some minutes and stuff, so if you guys wanna,
Yeah, since we went into session, is Sean still with us?
Sean is still with us.
Okay, since we went into session, I'll entertain a motion to adjourn. So moved. I guess to make it simple, I'll second. And this needs to be a voice vote, so Sean?
Aye.
John?
Aye.
I'm an aye. Thank you.
bye. See you in a couple weeks, right? We have next week off? I think so, yeah. Okay. Old business, do we have anything to discuss from the previous meetings? I don't think so. Okay, so now we'll go into the minutes. There's several here that we need to approve of. So, did anyone have any comments? Did everyone take a look at them?
One.
Yep.
January 27th, I think is on the second page. There's a reference to me as the vice chair. I think you want to change that.
Oh, the June 27th? Okay.
And is the date correct on that one?
We can update that, yeah.
Can you update that? Okay. Does anyone have issues with any in particular, or I think everyone was, there may be, let's do the June 27th ones separate, just because I don't think, John, I don't think either of them were sworn in at that time. But I'd like to just take two votes, one on the June 27th and then for the rest of them, is that?
I got one issue. I was not here at the 25th, on the 25th.
On September 25th?
Yeah.
All right, we can.
So if you want to do the
we'll take-
19th, the
we'll take
7th.
that separately. Okay, so let's do the June 27th tri-board meeting.
Motion to approve.
Second.
Perfect, okay. All in favor? Nate?
Aye.
Dennis? Shelby? I'm an aye. So they just abstain, right? If you guys want to abstain. John Leffers?
Yeah, I think I'm abstaining on that
Okay.
one. so-
Hari? Aye, and Shinji? Okay, so that one passes. 2, 4, 5, 6, 0, 2. All right, let's do August 19th, 2024, tri-board.
Motion to approve.
I'm gonna do a few of them.
Okay.
November 7th, 2024, tri-board meeting. October 17th, 2025, Finance Committee, and January 8th, 2026, budget hearing.
Motion to approve all is listed.
Seconded.
Okay. All in favor? Nate?
Aye.
Dennis?
Aye.
Shelby? I'm an aye. John?
Aye.
John? Shinji?
Abstain on November 11th one.
Okay. Hari?
Aye.
Aye. Dan, can you, okay, just,
Shinji, which one did you abstain on?
November 11th, I was not around.
the November 7th?
Or 7, yes.
November 7th, okay.
Can you
Thank
take them like that, or do you want me to pull that one out?
I
Is
think
that
we
fine?
got, yeah, that's fine.
All right, perfect. Okay, and then the last one is September 25th, 2025, Finance Committee. Motion to approve?
Motion to approve.
Second.
Okay, all in favor, Nate?
Aye.
Dennis?
Abstain.
Shelby? I'm an aye. John?
Aye.
Aye.
John? Shinji?
Aye.
And Hari?
Aye.
Okay, so our minutes are done. Next, the board and committee updates, again, I just leave these here in case there's anything. I don't think there's a ton except for health insurance and Robinson School. So let's just go in order. Health insurance. Nate, did you have an update?
Yeah, sure. And, I'll try and provide some of this in a stand to fill in any holes that I might miss. But Health Insurance Trust had voted in the fall to move forward with engaging a consultant. We've talked about that here before, to do an examination of the current model of our health insurance and compare it to other models that may exist, including but not limited to group purchasing, such as the Group Insurance Commission, Maya, or similar consortiums, fully insured models, et cetera. And so a full scope of service was developed along with an RFP that was put out to bid. We had several bidders, and the recommendation went forward to hire one of those from that process. And so Lockton companies,
Is it Lockton?
Lockton.
It's called Lockton.
Lockton,
There we go.
was selected and hired to move forward with that. I'd point out for the Finance Committee's sake that the funding for that comes from the trust itself, not from the town. And they've now begun their work on behalf of the town. Is my understanding, Dan, that I think within several months' time, by the late spring, we should have some sense of their final report with options available that the town of Westford might want to consider. It is in the RFP that they shall present to the Finance Committee as well as the Select Board and the Health Insurance Trust. So at some point that'll be coming back to us. I had just a brief meeting with the president of Lockton, who's running this, and was very impressed by his knowledge, the communities they've worked with. They've worked with several communities all across the Commonwealth. And I think what's important to point out about this is that this is a consultant, an expert that's doing an analysis, and no part of this work is brokerage services. In other words, we're not looking to them to then turn and become our broker. The Health Insurance Trust already has a broker of record. And so this is really an independent analysis that is agnostic as to which direction the town chooses. At the end of the day, they're a flat fee, they get paid to do the analysis. And I think that was really important, and just want to say as the Finance Committee's member of the Health Insurance Trust, I'm very pleased with where that is right now and the direction it's going, and we'll see what comes out of this process in the end.
So they're supposed to come up with recommendations as to what we're supposed to do?
I don't know if it's as much recommendations. I think the scope of work actually said provide an analysis on various options, and then the town can choose. And so I think that was actually the way it was drafted in the RFP, which is important because I think that's part of the decision for the townspeople to make. And folks could ask them, I suppose, as part of their presentation. But yes, it's providing analysis. It's possible that one of the outcomes is that the current model works and is the best choice. That's one of the things that is a question in the scope of work and the RFP. Dan, I don't know if anything you want to add that I missed.
No, that was thorough. We're going to start getting updates a week or two just on our progress. So they are going to check in periodically with us. So
I feel like I can't remember what sort of meeting it was, whether it was a town meeting or not, but somewhere along the line, we got a lot of pushback on that very specific question about whether the group that we were using to consider insurance was the one that would be doing the brokering or not. And so it kind of introduced the possibility, real or not, that there was a conflict of interest there. So I think this will help a great deal in messaging.
And this would position us to potentially make a change for our November open enrollment?
Certainly could.
There's enough time.
Yeah, I would point out that one of the interesting challenges right now that the Health Insurance Trust faces is that we are on a November timeline, which is very odd, but that's the way it was set up. And so things like the GIC and other options typically are not. Secondly, a second awkward thing is that our reinsurance, our what do we call that?
Stop loss
reinsurance program is on a March renewal.
Oh, that's right.
So the two are not aligned. So in the event there's a decision to move away from self-insured, that ultimately be a decision of the Select Board, I believe, at the end of the day. That not the trust itself, but because the trust is created by the Select Board. And if the Select Board did decide to do that, it raises questions just about how do you do that from a fiscal perspective, and what is the exposure to the town. There would certainly be run out of claims, which is to be expected, and so on. But I would also just point out, though, that I think that in our current state, Dan provides regular updates on the trust balance, and the balance itself is in a healthy spot right now.
It's north of $5 million right now after a rocky start, so it was all timing getting into the trust, but we're running well. We're seeing double-digit increases in other areas for next year where we have a modest increase in the budget, and that's the projected amount to meet the estimated expenses for next year, so.
And I would just, part of the message that I'm carrying at the Health Insurance Trust that I think is just important perspective is, even though we are in a good spot, we still owe it to the people of the town to determine if this is the best overall utilization of resources. And even single-digit percentage increases when other health insurances and double-digit percentage increases, if we can save significant money, it's worth exploring that and what the pros and cons of any options are. And that's what the consultant's going to examine and provide a report on.
And we're running well now, but that could change.
Right. One of the challenges the Health Insurance Trust, in my opinion, faces is our incredibly small pool, and then the impact that has on our stop loss insurance when we've had years that had,
Couple of big claims.
if you tune into Health Insurance Trust meetings, you'll see discussions about one individual's care plan when we don't know who that person is and can't, but we know that it's expensive and it's a certain type of treatment. And if we can get to that person about pursuing alternatives, and it feels a bit like a game of whack-a-mole with a very small risk pool. Once you solve that, it feels good for a bit, but it is a concern in the long run about the exposure. For me personally, as a member of the trust.
And Nate, is part of the consultant's scope of work to sort of map out a change if we need to be, for example, the dates not aligning, like, could that be an outcome of this work to say, do X, Y, and Z, or not so much?
That's a good question. I don't know, Dan, if that's in the scope.
I don't think so. I think they have a defined scope that they meet, and then we still have our broker that would help with any sort of change like that, actually implementing it. So
I'm just wondering if they do all this analysis on plans X, Y, and Z, but X is, let's say, GIC, which causes us to have all these runouts and everything because the dates don't align, like, will we have that information to look at a complete picture?
Yeah, that I think we would,
Okay.
Per se. I want to point out that runouts can happen no matter what you do if you go from self-insured to anything.
Sure.
The theory is that and this is important, in health insurance, the theory would be that when you started your plan, you had months and months and months of premium collection with no bills, and that's built up. That didn't happen for us because our premium collection was quickly exceeded by the claims, which required the town to do a bailout, right? So that you're now paying for it. No matter what, you're paying for those claims. It's a question of whether or not you're still enrolled in the plan, so you're kind of using next year's cash to pay for last year's costs, and at the same time, I would almost equate it to when instead of trading in your car, you decide to buy a second one for a little while and pay taxes on both of them and operational costs until you don't need the second one anymore. And so that will happen no matter what. You're paying the same amount. It just feels, because you're all of a sudden not getting that service anymore and having to pay it without the income from the premium for it, that's where the challenge comes.
Yeah.
In theory, the income from the premium the previous year should have covered that, but it's a little grayer than that in how it actually
It's sustainable.
Well, I actually think where our balance is right now is in a very good spot and could be sustainable. It is also very expensive.
Okay, thanks. John Robinson?
Yeah,
School?
Robinson School Committee is doing the dance with the MSBA. There's kind of a cadence now set. We're busy, and there's a schedule that's really kind of set for everything. So we're kind of in this cadence of getting RFPs or RFSs out. We work on those together. We get those out. We get a list of vendors. We select a vendor. They, in all instances thus far, they've been experienced people that have worked with the MSBA before. They're familiar with them. So that's been fine. We selected an OPM in Vertex. And now we're in the process of, we completed and have then gone back and forth with the MSBA about selecting a designer. And so now there's been good, we had an open house at the end of last year, and then now we're to the part where we have a list of them and we have a committee that's working on evaluating those.
So you have the bids back, or the?
We have a list of names right now. I'm not sure exactly. We last met on December 9th, and we're meeting again on the 20th. So that's when I'm going to get the update about what's actually happened this morning. I just got an update that we had like 15 names show up that look promising, something like that for designers.
Well, the responses to the RFS for designer services came in yesterday at 11 o'clock. We had 9.
Okay.
Those have been passed on to the OPM, so they'll be putting together the review matrix.
Okay.
Once that selection is made, we're on a fairly tight timeline to take that selection to MSBA and get approval to enter into a design contract.
So the way an MSBA program works, and I guess I'm not too familiar, you do an RFS, you get your designers, do you narrow it down to one person?
You narrow it down
and then
to,
go
yeah.
forward with the project?
Then move forward with a fee negotiation with them at that point. So the proposals that we've received are non-fee, and then we do the fee negotiation after we select. If we cannot come to a fee that we agree on, we move to the next one on the list.
Gotcha. Okay.
And this is just to, the result of this is just to then figure out what we should do with it.
It is.
There's no
Yes.
decision being made and
No.
they're going to design a new school or something. It's to figure out what to do.
Now, the next decision, the decision that will be before the committee will be to select a designer for recommendation in MSBA. At that point, they will engage in the study of, the full scope. Here's your options. These are the different potential sites that we could look at, et cetera. And then the decision will be 18 months down the road as far as the direction we ultimately go.
So they're going to come up with the options.
Yes.
Yes.
Okay.
Yeah, in the meantime, the MSBA really manages the whole process very closely. So, I think even the forms that we use to fill out to evaluate the different vendors they come from them. We fill them out, and then we send them on to them. They give comments. It can come back. Sometimes it's just changing the spelling of something. I think it was like the last one was like one comment on spelling something incorrectly. So then we send it back to them, and then they approve it, and then we move forward, and then we have a meeting a week later or something. It's like we've got a very rigorous schedule of meetings coming up between now and call it mid-March.
Yeah, it's a highly prescriptive process.
It's very prescriptive.
Documents, et cetera.
Yeah, and I feel grateful for the team, for the committee members that we have on this. There's a lot of tradecraft, a lot of trade talk that is a language unto itself, and that they've been through this process before, a lot of them. So I feel like we're in pretty good hands there, along with our OPM seems very experienced and very solid as well.
Been impressed with them so far.
Yeah.
Great.
So far, so good.
Well, that's good. Okay, so our future meetings, we're not meeting again for 2 weeks. So the 29th is our next meeting, and that's the schools and police.
Yeah.
Yeah. And then obviously the rest of them are on here. So I think we're done for tonight.
Do we anticipate that we will, I see it says if necessary February 12th, so we will need our February 26th meeting?
The February 26th, yeah, we will. Is that during vacation?
No, it's the week after.
All right, I was like, I don't think we.
So I know we have quite a few CPA applications in this year, like upwards of 17. So they need some extra time. So we know CPA will be on the 26th most likely.
Gotcha. Okay.
Hey, do you have a conflict that day?
I don't know.
On the 12th, you might,
No,
or?
26th.
Oh, the 26th.
I can't, it's possible.
Okay. I think we will because we usually, I don't have the timeline in front of me, but the FinCom book, everything kind of butts up against.
Yeah, the edits are due like the day after, basically.
Yeah.
We're kind of wrapping it up at that point.
Is it that? Oh yeah, it's that quick, so, okay.
Yeah.
I probably just need to join via Zoom.
Okay, that's fine. All right. Sounds good.
Motion adjourned?
Second.
Yep, perfect. All in
Aye.
favor?
Aye.
Dennis? Aye. Shelby? Aye.
Aye.
Shinji?
Aye.
Aye, and Hari?
Aye.
Awesome. Thanks, guys.